Got it. I don't think I got the
It popped up on my screen. It might just be that we need to hit broadcast. Oops. Or I'm just gonna do this for myself.
Okay, then it says Alicia, room 1 asked for help.
It's because nobody else was there, but I just assigned Abraham to the breakout room. So now the help that she needed is wondering why she was alone. And now she won't be alone, and Abraham will be able to present to her. Thank you, everybody, for your patience and working through us. Zoom worlds are tough worlds. We are very grateful that you are here tonight, and we're really excited to present to you. Kathy, could you start to share your screen? And Julie, will you be helping with the stuff in the chat?
Absolutely.
So, good evening, everyone, and thank you again for being here. For those of you who haven't come to any of our previous presentations, we're very glad that you're here. If you have been to some of our previous presentations, I'm delighted that I have not yet scared you off. For those of you I'm just getting to meet, my name is Naomi Hagel, and I am a credentialed person-centered thinking trainer with the Learning Community for Person-Centered Practices. I'm an independent facilitator statewide for self-determination services. I'm an advocate to help people receive services they need through various systems. And I'm also a member of the Education Spectrum team that has contracted with North Bay Regional Center to streamline and assist with the self-determination process. With me tonight are 3 other members of the Education Spectrum team: Abraham, who's over in our Spanish room, Kathy Gott, and Julie LaRose. Kathy or Julie, do either of you want to introduce yourselves?
No. You take it away. Well, I'm a mom with a self-determined adult son and just happy to be here. Thank you.
I am also a mom to 2 adult sons on the autism spectrum, and 1 is self-determined. And I'm an independent facilitator.
I am not a mom, unless we're counting the cats. But I am a former regional center manager, and I oversaw self-determination at a regional center in the LA area. And because of that, I have a unique perspective wherein I've been where the staff at North Bay Regional Center and every regional center are. I've felt what they feel, and I know what they're up against in terms of workload and priorities. But I'm also intimately aware of and hopefully responsive and open to the needs of individuals and families and the requirements the regional center staff need to adhere to in order to both follow the law and ensure the rights of participants are respected. I know that regional center services sometimes can feel like another language, and self-determination kind of feels like a dialect of that language. So I want to assure everyone tonight that there's no judgment here. We really appreciate that you're all taking the time and making this a priority to be here, especially during the holiday season, because I've been making a joke for the last couple of weeks that December doesn't exist because that's what it feels like. So we really encourage any interaction that you are comfortable with, and we appreciate the honesty, transparency, and vulnerability that occurs during these trainings. You can feel free to share or ask questions in the chat or verbally if you choose. If you want to share something verbally, you will need to raise your Zoom hand. And at certain parts of the training, we are specifically going to solicit questions, and we will make it so that you can unmute yourself and ask verbally. The budget, which is what we're going to be discussing tonight, is one of the parts of self-determination that brings the most questions, anxiety, and excitement, sometimes all at once. Today, we're going to discuss how budgets are created, as well as the role of the Financial Management Service, which we sometimes refer to as an FMS. And the FMS is the only required vendor, which means contracted with the regional center, service that every participant in self-determination must have. We hope to demystify the process of the budget in self-determination and debunk any myths you might have heard about the budgeting process. Overall, and perhaps unfortunately and or disappointingly, the budget process probably isn't going to add funding for everything you are hoping it will. And it definitely isn't going to purchase services from generic resources, which are those that are not funded by the regional center, like the school district insurance and or in-home supportive services, or IHSS. And these are resources which are required to be used before regional center funding in both the traditional and self-determination service delivery systems. The budget also can't add money for things that are a typical parental responsibility of any child and any parent under age 18, regardless of their diagnosis. And the budget also isn't going to add money for things that aren't directly related to treating or managing the regional center qualifying disability. So this includes that the funds aren't going to be able to be used for things like trips to Disneyland, cars, or hot tubs. Over a series of 6 trainings that will continue to happen once per month for the next 3 months after this session, we are covering a lot of areas to help you in general. In fact, in February and March, you will actually get the opportunity to hear from some independent facilitators, person-centered planners, and financial management service agencies directly. However, I also always want to encourage you to think outside of the box, even when I'm not talking to you. If you take nothing else from this session today, I hope that you will consider that self-determination doesn't have to be, but might be a good choice for you or your loved one, and that you have the right and hopefully will be given the ability to make informed choices about what service delivery system you want to utilize. In addition, if you have case-specific questions or concerns that come up between trainings, please feel free to reach out to our Education Spectrum team. Julie is going to put our coaching link in the chat, as well as our email addresses and the contact information of the North Bay Regional Center Self-Determination team as well. The email addresses that we are putting in the chat, you are able to reach staff who speak both English and Spanish. We do encourage you, if you're having specific challenges, to speak to North Bay Regional Center, assuming that you are a client of North Bay Regional Center, because it will help them to help us make these trainings more useful for you if there are common concerns, questions, etc. In addition, we really encourage the North Bay Regional Center community to attend the bi-monthly local advisory committee meetings, which are currently held via Zoom, which gives you an opportunity to be part of the self-determination community at North Bay Regional Center and to share questions, concerns, successes, or challenges that you might have with both the North Bay Regional Center staff and the Education Spectrum team, as well as the greater community as a whole, and for all of us to brainstorm solutions to any challenges together. The next meeting of the North Bay Regional Center Local Advisory Committee is in January, and we'll be putting the link in the chat where you'll be able to find more information about that. In our last sessions, we have provided a general overview of the self-determination program as a whole, as well as the role of independent facilitation and person-centered planning. I want to be clear that those meetings, nor this one or any of the future ones we are going to have, didn't and don't replace the mandatory orientation that participants interested in joining self-determination must complete. In the chat, we're going to put the link where you can complete that orientation if you haven't already, or quite honestly, because this is a lot of information, even if you have done it and just want a review. Next slide, please. So throughout our training series, we frequently talk about being person-centered, which can include the regional center listening to individuals supported and figuring out how to meet needs and desires in a flexible way. However, it's important to realize that no one can be person-centered towards individuals supported by the regional center unless some person-centered thinking is also directed at family members and staff as well. Person-centered thinking isn't just about disabilities. It's about humans, and it's about better lives, not just better paper. Specifically, we need to look at things that are important to people, the things that make someone happy and contribute to their quality of life, like my cat who is currently completely passed out next to me, but also things that are important for someone, which are things that keep someone healthy and safe. When we look at important for in the context of these presentations and trainings, I'm going to refer you to this slide here. Reason you can't understand me, all I have done is wasted your time. I have been told that I talk really fast in the past, for example. I make perfect sense to myself because I've been listening to myself for 34 years, but I also already know this information. If I start talking at the speed of light, a way to best support me, just like you think of the ways to best support your loved ones, for example, and like I hope these trainings best support you, is to let me know. You are not going to offend me if you put it in the chat, but if you're shy, feel free to private chat one of our team members and they will rein me in. In addition, we are in a Zoom world and the internet doesn't always cooperate with us. I like to be on camera because I think it makes me seem more human to y'all. But if the Wi-Fi fails me and you start noticing that things are garbled, for example, please make it known in chat. If you're not sure if it's you or me, that's okay because I probably won't be either. But you can private chat it to one of our team members and they can help figure out if it's widespread or isolated. Telling us in the moment gives us a chance to fix it in the moment so that you can benefit more. I can turn off my camera or I can switch Wi-Fi networks, or you can find out that you need to do one of those things. But either way, we win. Next slide, please. So on this screen here, you can see an outline of how we are going to move through today's trainings. Each of our training sessions is similar in that for about the first 45 minutes of the scheduled 90 minutes, we will do the training part where I give you information. The second 45 minutes is a more interactive question and answer session because no one needs to listen to me talk for 90 minutes straight. While of course we're going to have that question and answer session at the end of today, like always, I also recognize that the budget is a bit of a heavier and perhaps more confusing topic. Therefore, I really encourage you guys to write any questions you have throughout the presentation in the chat as well, and we will try to address them during the presentation and between slides, unless I know for sure that they're going to be covered in the next slide, for example. Speaking of next slide, please. So to start off, there are two really critical terms that are tossed around when talking about self-determination. And unfortunately, they are sometimes used interchangeably when they are interconnected, but yet very different. These two phrases are budget and spending plan. You may have heard someone use these phrases to mean the same thing, or you might not have been aware before looking at this slide what the difference was, or even that there was a difference. Tonight, we are here to talk specifically about the budget, which is the amount of money that an individual is able to spend over a 12-month period once they transition to self-determination. The spending plan, on the other hand, is something that we're going to go into more detail about next month. It's the fun part, in my opinion, where the participant or family gets to indicate what services they're going to purchase and how they're going to actually spend the money, while following some requirements and rules, because this is, after all, state and federal taxpayer money. As a reminder, one of the core values of self-determination is responsibility. And everyone, the participant, the family, the regional center, has responsibility to ensure that these funds are used appropriately. Next slide, please. One of the biggest questions that I hear now, and that I heard when I worked for a regional center, when a participant or family gets really interested in self-determination is, what is my budget? Or can I have my certified budget? I mentioned earlier that we're going to be debunking some myths about the program and about the budget. And one of those myths is that the regional center can and should immediately hand you a certified budget. Unfortunately, there is a lot of misinformation out there about self-determination, and not being able to receive this budget immediately upsets or confuses some people. You might be concerned that the regional center doesn't want to help you transition to self-determination, or you might think they're hiding something from you. Some people have had negative experiences with the regional center, and those are valid, and I don't want to pretend that they haven't happened, for example. But the fact of the matter is that even if you didn't realize it yet, you don't actually want the regional center to give you a certified budget right away. A certified budget means an agreed upon budget. And a budget isn't certified until the regional center and the participant or their legal guardian both sign off on it that they are in agreement, or that there are things that they want to take to hearing if there are disagreements, because you do have the same rights in the traditional system as you have in self-determination, including the right to appeal decisions that you don't agree with. If the regional center just handed you a budget and said, this is your certified budget, that's not person-centered, and they haven't taken into account unmet needs or changes in circumstance that can impact the budget. And yes, I'm going to define what those mean in a minute. If the regional center just hands someone a budget and that's it, they have essentially created Regional Center 2.0. And truly, nobody asked for that. With that said, it is completely reasonable to want to have a starting point or an idea of what sort of funding or numbers you might be looking at. And some person-centered planners or independent facilitators might even ask you to provide them with some information like this early on. As a reminder, after orientation, the next step really is to connect with an independent facilitator and have an outside person-centered plan completed, like we talked about in our last meeting. We've put some links in the chat as to where you might be able to find providers for these services, which, when they're done right, really help to walk you through the process and find appropriate services. However, that's also not all you can do. You can also request the Regional Center provide you with a copy of what is known as the Consumer Cost Statement, or the last 12 months expenditure report, which shows what the Regional Center spent on your services in traditional services. While this is not a certified budget, nor is it a guarantee of the funding you will ultimately receive, it can provide valuable information. Now, one area of frequent confusion is about that person-centered plan I just mentioned. Sometimes people submit person-centered plans and they're beautiful and they include a lot of things they would like and services they need in the person-centered plan. And they believe that because it's in the person-centered plan, the Regional Center is obligated to fund it. However, that's myth number 2 that I'm going to debunk. The Regional Center is not required to fund something just because it's in the person-centered plan. The person-centered plan is a great tool, to be clear, and I highly encourage you to have one completed, but it's just that, a tool. It's not a legally binding document, and just because it's written in the person-centered plan doesn't mean the Regional Center can, will, or is going to fund it. What sometimes gets confusing in self-determination is that people think that they just have this money and they can use it for whatever they want with no rules or guidelines. And that's not true, as I alluded to earlier. All services are still held to the Lanterman Act, which is the law that all Regional Center services in both the traditional and self-determination service systems are held to. Furthermore, the Regional Center will still use their policies to determine funding. What this means in practice, for example, is that if the Regional Center has specific rules about who they fund transportation services for example, those same rules will still apply when they're creating the budget as to whether or not they put funding in the budget for transportation. In addition, generic resources, which are those that aren't funded by the Regional Center, still have to be used first, and typical parental responsibility for a child under the age of 18 still applies. Overall, there are 27 pages of definitions of service delivery, definitions of services that we're going to discuss in more detail in the next training. And all of those 27 pages have certain rules before they can be utilized. However, in the meantime, if you're interested in some light reading or you have terrible insomnia, we are going to be putting in the chat a link to find those definitions and read more about them, as well as a breakdown we have created that hopefully simplifies the information. In general, it's really important to understand that even if a service is allowed in self-determination, like massage therapy, for example, if the regional center doesn't fund it in traditional services, money isn't going to be added to the budget for it. If the participant or family wants to access a service like that, they will need to move money around from other parts of the budget to do so. This is required because the self-determination law was passed with the understanding that it would be what's known as cost neutral, meaning that it wouldn't cost the state any more than traditional services did. If money was added to the budget for services not available in traditional services, that won't be true. But this is also why, for example, funding can't be added to the budget for the cost of an outside independent facilitator, like we talked about at our last training. As you may have heard before, the budget starts with the last 12 months expenditures from traditional services. This makes people panic sometimes. They say, but I couldn't receive services, or there was a global pandemic and the day program was closed, or I just became eligible 3 months ago. I want to assure you that that is okay. There are ways built into the budgeting process to account for these types of situations, which is called annualizing services. And there are also other ways to change the budget that are specifically known as unmet needs and changes in circumstance. Unmet needs and changes in circumstances are really the only ways that a budget can be changed, both during the initial process and throughout the year. And the person-centered planning process can be very helpful to find these. An unmet need is a service that may have been in an individual's last individual program plan report, or IPP, which is ultimately the legal contract between a participant and the regional center. But for some reason, that service wasn't utilized. An unmet need can also be something that wasn't even documented in the last IPP, but it was still needed. This might be something like respite that wasn't utilized because the agencies didn't have staff available, or day programming or transportation that wasn't available because there was a global pandemic closing down the services. It might be other services, or it might be when the person-centered plan comes up with a need for a service that an individual previously didn't have or didn't even know about, but still needs. For example, maybe under the regional center policies, they qualify for more respite hours than they were actually funded for. What is not an unmet need for the purposes of increasing the budget are services that aren't funded in traditional services, like acupuncture, massage therapy, etc. If an individual identifies an unmet need for a traditional service, the regional center will still use their policies and procedures to figure out how much money will be added to the budget. For example, if you qualify for 30 hours of respite per month in traditional services, that is the amount of funding that you will also qualify for in your self-determination budget. Now, this doesn't mean that you can't choose to pay a provider a higher rate or pay more for a service once you get into self-determination via the spending plan that we're going to talk about at our next training. But it does mean that the regional center isn't going to, and actually isn't allowed to under the law, provide you with a higher rate of funding than they pay in traditional services. So just because you choose to pay $50 an hour for your respite services, for example, doesn't mean the regional center is going to give you $50 an hour for the respite provider, even though I recognize that they are likely worth it, especially to you. A change in circumstances, on the other hand, means that life has changed and so have someone's needs. This can be something like when an individual leaves school at age 22, if they get very sick or they get better, if they move into or out of their family home, they get or lose a job, they re-enter school, there's a global pandemic, etc. Now, one complication, and myth number 3 that I'm debunking tonight, is that a change in circumstances does not always mean that the budget increases. A change in circumstances can decrease the budgets. And oftentimes, in my experience, participants and families don't realize this. For example, some individuals may have received additional services even during the last 12 months as a result of COVID-19. And since other resources like day programs in school districts are now available again, that funding may be removed from the budget. In addition, just because funding is added or included one year doesn't mean that it's going to be ongoing forever. Some services, like behavioral services, for example, are time limited or may be expected to fade after a period of time. The budget process is redone every year, and one of the benefits of having an outside independent facilitator is that they can continue to update the person-centered plan each year to demonstrate what needs are there in order to secure ongoing regional center funding. If funding is added to the budget for an unmet need or change in circumstances, the amount of money that is typically added is the rate that would be spent in traditional services because of the concept of cost neutrality that we talked about earlier. Therefore, the regional center will use the rate per hour, per day, or per month, for example, that they pay in traditional services and plug that into the self-determination budget. In addition, like I mentioned before, the regional center will still use their policies and the laws to determine what funding can be added. So if you wouldn't qualify for a service in traditional services and there's no cause for an exception now that you're trying to transition into self-determination, money isn't going to be added to the budget. With that said, there are ways that money can sort of be found to fund some of the services not typically available in traditional services, as well as the independent facilitator that we previously mentioned. Because, for example, looking at respite, the regional center may be paying $25 per hour for this service. However, the respite worker is only going to get paid minimum wage, and the rest of the money is helping to keep the respite agency's lights on. In self-determination, the participant and family will have access to that full $25 per hour, and even accounting for the approximately 20% of taxes and fees they will need to pay on top of the hourly wage, they could still choose to pay their respite worker $19 an hour, for example, and they also would still have extra money for every hour left over that could be used for other reasons. Overall, the budget is developed and finalized by adding together the last 12 months' expenditures and the unmet needs, and then adding or subtracting funds for changes in circumstances as appropriate. A budget is only certified if the participant or legal guardian and the regional center sign off that they are in agreement with it. And if the participant or family member doesn't agree with a decision made, like not to add money for a certain service, for example, they do have the same appeal rights as they do in traditional services, and you can request an impartial fair hearing, for example. Before I move on to the very few services that are handled outside of this budgeting process, I'd like to give people an opportunity to ask questions if they have any. So you can either put them in the chat or raise your Zoom hand if you'd like to ask a question about the budgeting process out loud.
Naomi, I just wanted to add, just from a parent perspective, that one of the most exciting things about our son's transition into self-determination, we had a couple of main services for him as an adult. One was supported living services, and the other was a job coach to accompany him to work full-time. And my son has 24/7 care needs. So using IHSS for the overnights, it leaves all the day hours. And the rate was pretty significant, I think, and such that the agency that we had to use, because the neat thing about self-determination is that you don't have to use a vendored agency. That is it opens up, like, you get to pick the staff that you want to support yourself or your loved one in self-determination. You're no longer bound to depend on an agency and the staff that they send you. And in doing so, we pay some staff, like some real experienced care workers, $30 an hour, and some get 25. And it's a game changer. The turnover was awful. It just, people came and went. It was very hard on our son. He would take it personally and get really sad. And now we're in our second year of self-determination. We haven't had any turnover because people are getting paid. It's a lot. It really adds up with full-time work. It's pretty significant. So I just wanted to point that out. I'm not saying you can use a vendored agency, certainly, but you have so much more choice in self-determination. Thanks.
I love it, Kathy.
Naomi, did you see the question in the chat from Rachel?
I did.
Okay.
Sorry. I'm going to read it out loud, or if I'd stopped talking for 5 seconds, Julie would have done it for me. Sorry, Julie. And then I'm going to answer it. And the question was, the first question was, can unmet needs include 24/7 nursing for an adult that lives at home with his mom, i.e. not independently? And the answer to that question is very much, and the answer to a lot of questions is, it's going to depend on the need and the specific case, as well as the generic resources. So remember, even in self-determination, the regional center is the payer of last resort, meaning that all generic resources have to be exhausted first. And so in that case, when I'm looking at nurses, specifically for an adult, we need to look at what's known as the Home and Community-Based Alternatives, or HCBA waiver. And Julie, I don't know if you have the ability to search the emails that I sent you recently, because I sent links actually to NBRC's team with a lot of information on this waiver through Medi-Cal that can potentially fund nursing services up to 24 hours a day. That resource would have to be used first before the regional center can provide any funding, much less 24/7. Now, there are situations where the generic resource is not appropriate or doesn't meet an individual's needs, but you have to be able to show that and show your attempts to access it and why it doesn't meet the needs before the regional center can consider making an exception to allow you not to use the generic resource. In addition, I think the other thing that's important to keep in mind is that the parent of an adult child does not have a typical parental responsibility or a requirement to care for them. And that can be really hard for people to wrap their heads around, because you love your children and you want to take good care of them, and you've always taken good care of them. And that's wonderful, and we're really glad that you do that, but also you're not required to. So I can't answer the question specifically about 24/7 nursing care, because technically the regional center could say, well, our policy is we don't fund 24/7 nursing care, and they would be right. But if the generic resource has been exhausted, and Julie's looking for some links to put in the chat about the generic resource specifically, if the generic resource has been exhausted, and if the individual still has needs on top of that, ultimately every policy has an exception, and policies don't override the law. The Lanterman Act specifically requires that the regional center meet the needs. So if the needs exceed what the policy allows, the regional center has to make an exception. So the answer to your question is maybe, possibly, but we would definitely need more information to give a specific, to give any more specific advice on that. And that would be a really great reason to have an independent facilitator who is familiar with working with individuals who may be medically fragile in particular.
Naomi, these are the right ones, right? That I put
yes,
in there? Okay.
Yes. So Julie just put some links. in that talk about that home and community-based alternatives waiver that I just mentioned. That would be the generic resource for somebody who needed nursing care. And then the second question that Rachel had was, can a self-determination budget fund both a one-on-one nurse and a day program simultaneously? And again, that goes back to the need and the generic resources and the individual client. If that is what the individual requires in order to be able to attend a day program, then yes, the budget can do that if there are no other resources. But it's going to be about the needs, and it's such a highly individualized situation that I can't say, yes, the budget will definitely do that, because I don't know the specific needs. And then the third question was, any recommendations on finding a day program that will allow a private nurse to come in with the client? Honestly, that's going to be really hard. A lot of traditional services vendors have a lot of reservations about the self-determination program for a variety of reasons. And some of them are liability related. And ultimately, day programs and most agencies are private agencies. And because they're private agencies, they can have rules and requirements, and they can say, we're not going to allow an outside staff member to come in. And as long as they're not doing that specifically because of one specific person's disability, then it's going to be allowed. Now, my recommendation on things like that typically comes down to money. The reason why in many cases, a vendor may be concerned about having to use self-determination funding is sometimes, not always, because they simply don't have the capacity to do another bill, another invoice a different way. And it does take time and it is work. You have the ability in self-determination to sweeten the pot and to say, well, your daily rate typically is $35 per hour, but I'll pay you $40 per hour if you allow that. And that, for many people in a capitalist society, might really help to say, okay, this makes sense, I'll give it a shot. The other thing I want to caution, which was not at all your question, but I'm going to answer it anyway, is that one thing to keep in mind when you're looking at day program or any services in self-determination in general, is that services have to meet what's known as the home and community-based services final rule. And what this means is that services have to be community integrated, and they have to provide people with the opportunity to make friends and interact with people, and not just staff, who do and don't have disabilities. And so some day programs probably are not going to meet that requirement if they're too segregated. So I'm not saying you can't use a day program vendor, or you don't have to use a day program vendor, or that you shouldn't use a day program vendor, because I don't know your particular situation, and that might be the best fit for you. And I want to make sure that you know that it's the needs that matter the most. But you do have that flexibility that Kathy was mentioning, where you don't have to use a day program vendor. Instead of saying, let's go to a specific day program, maybe you can have that private hire nurse and you guys can develop a schedule together where you go swimming on Monday and horseback riding on Tuesday, and to do Meals on Wheels on Wednesday. And it's sort of like day programming, but instead of somebody else being in control of it, you're the one making the schedule. So that is also an option that also gets around the issue of somebody or an agency not wanting to accept self-determination funding or a private duty nurse. I would be curious to know if Rachel could just share if that actually answered the question, or if I just talked for 5 minutes straight, because both are possibilities.
We have another question, raised hand from Jerry.
Awesome. Kathy, do you want me to unmute her?
Sure.
Okay. The whole millennial thing. Oh,
Hi,
Julie must
thank
have done
you.
it.
It said the host. Anyways, I'm here. Hi,
It worked.
thank you.
That's what
Yes,
matters.
perfect. So a lot of Great information. Thank you so much. And I'm just trying to wrap my head around all the information and make sure that I'm processing it correctly. And just want to ensure that I'm understanding the benefit of SDP, because when we're talking in terms of budget, it sounds like a lot of it is leaned towards going back to the traditional model when we are determining the budget, right?
Yes.
But that the benefit is that you're not paying for the overhead in the SDP if you go the SDP route, if you're exchanging a service for a service, like the respite example. Is that correct?
Yes, it also gives you
Okay.
the opportunity to pay people more, which is really important because, unfortunately, and it's not because they don't want to pay more, but a lot of the traditional services vendors aren't able to pay as much as they would like to due to the rates that they receive. And it also gives you the opportunity to work with people and contract with people who don't have contracts with the regional centers. So I always say that a lot of the vendors, do a wonderful job. And I really don't want anybody to think that just because we support self-determination doesn't mean that we simultaneously don't really appreciate and support traditional services vendors too. Kathy has actually been a traditional services vendor for, I want to say 30 years, but I could be wrong. And so we absolutely do, and they're the right choice for people. But here's the thing. Right now, there aren't enough traditional services vendors, first off. And secondly, some of them have really long waiting lists. So for example, for the social and recreational services that were recently re-implemented, for example, a lot of vendors just don't have availability. Whereas if you can walk down the street and go to the YMCA and talk the YMCA into receiving third-party funding, then you don't have to wait that long. And you also might not have to travel. And when we're looking at North Bay Regional Center, where a lot of things are pretty spread out because of kind of the rural parts of the catchment area, it's a great opportunity to be able to potentially work with people who are closer to you and agencies that are physically closer to you rather than having to commute.
Okay, thank you.
You are very welcome. Kathy, did you want to add anything?
No.
I don't see any other raised hands or questions in the chat, so I'm going to move on to the next slide, where we're going to talk about the very rare services that are handled underneath, outside rather, of the self-determination budget. The vast majority of regional center services are going to be handled from the budget, but there are a few exceptions, which you can see listed on this slide. The first one is paid internship program payments for adults. The paid internship program is a program that can assist adults to obtain competitive integrated employment. Paid internship programs are payments to the person who receives regional center services for their work. It would be weird and pretty much inappropriate to have someone pay themselves from their budget. So it makes sense that these payments would be handled outside the budget. But when looking at this, it's really important to note how narrow it is. It is only the payments to the intern that are paid outside of the budget. If they're receiving job coaching, for example, that would be paid from the budget. Co-payments and co-insurance, the next one listed are competitive employment incentives. And those are paid to vendors or service providers if individuals maintain employment for certain periods of time. And those aren't the responsibility of the individual to track or provide. So again, the regional center would pay for those outside of the budget. Co-payments and co-insurance, on the other hand, are sometimes available as reimbursements to participants or families who meet certain financial requirements in the Lanterman Act. So they can't make more than a certain amount of money, and they have private insurance, and they're receiving services like behavior therapy, occupational therapy, physical therapy, speech therapy, etc., from that insurance. These would also be paid outside of the budget, but only if the individual would also qualify in the traditional service system. If you have questions about that specific service, we encourage you to contact your service coordinator to discuss the requirements, process, and potential eligibility. Rental payments are listed next, but don't get too excited. Overall, for all services in both traditional services and self-determination, just because something is listed as a potential service doesn't mean an individual is eligible for it or is going to receive it. Rental payments, for example, are only provided in extremely unusual, narrow, and time-limited circumstances where an individual cannot live in a residential facility for some specific reason related to their disability, whether it be medical or behavioral. These payments are only provided to adults who live independently and not any other family members. And they are even more rare in self-determination than they are in traditional services, because all services in self-determination have to be federally reimbursable, which rental payments are not. To be clear, in general, room and board are specifically excluded from services allowed in self-determination and traditional services because they are not services specifically related to an individual's disability. And they're actually disallowed by law because rent is considered to be a responsibility that we all have. Overall, Lanterman Act services are only for those costs that exceed that of anyone who doesn't have a disability. Finally, what are known as SSI SSP payments are the final listed item that is paid outside of the budget. These are small monthly payments that are made to adults who live independently and are otherwise eligible for Social Security or SSI to help defray living expenses. If you've gotten to the point where you're thinking, whoa, this is a lot of responsibility, you are probably not alone because you're also not wrong. This is the self part of self-determination, and I won't lie to you. Self-determination is work. There are things you need to understand in order to be successful in this service delivery system. But I do want to reassure you that while the transition and the first year in the system may be the hardest due to the learning curve, first off, it does get easier. You are capable of it, and there are ways to make it easier, like having a strong independent facilitator to guide you and using the financial management service, or FMS, that we're going to talk about next to assist with the responsibility and management of these funds. However, before we move on to that, I want to see if anybody has any questions. You can either put them in the chat or raise your Zoom hand. Kathy, can you unmute Rachel?
Yes, can you hear me?
Yes.
Okay, if the regional center has told me that ABA funds are going to be outside of the self-determination budget, does that make sense? And if so, do I need to make sure that they put notes in all the documents stating that? So I don't end up agreeing to something and then end up without the funding for the ABA?
So they're wrong, just being honest. But the thing is, you are not responsible for making sure the regional center does their job correctly. If they put, I mean, they need to put it in the IPP or individual program plan report that they are funding ABA, what rate they're funding at, and they should put in there that they're funding it outside of the budget. If it is in the IPP, that is a legal contract between you and the regional center, or the participant and the regional center, and they are required to follow it. Like I said, they're wrong. It shouldn't go outside of the budget, but that's on them to figure out and to handle. Now, one thing I will tell you is if you're okay with them handling it outside of the budget, then you don't need to worry about it. But if they're handling it outside of the budget, they are limiting you to providers that are vendored with them and contracted with them. If you want to use a provider that isn't contracted with them, but is qualified, you should have the right to do that in self-determination, in which case you need to make sure that they do it right and put it in the budget. And I know that it can be tricky to tell a regional center that they're doing something wrong. But Julie is going to put into the chat a link to the Self-Determination Program Ombudsman's Office, which is a DDS office that can assist participants with specific challenges that they're having and may be able to liaise between the regional center and the participant when there is an issue. Does that answer your question?
Yes, thank you.
I'm going to just lower your hand so I don't get confused. Jerry, can you unmute?
Hi, yes. So I just had a question just to piggyback off of Rachel's, and if ABA is the generic resource is an individual's insurance, a consumer's insurance that they're using, is that it's placed differently in that respect, right?
Well, if the generic resource is available, the regional center is not funding it at all, because the regional center won't fund something if it's available through the generic resource. So it won't be inside or outside of the budget because it's a completely separate entity, whether that be Medi-Cal or private insurance,
Okay,
that's funding it.
thank you.
You're very welcome. Thank you, Julie, for putting the ombudsperson's link into the chat. I'm going to give people like a couple more seconds just to put any other questions they may have in the chat or to raise their Zoom hand. But otherwise, I think we can move on to the next slide, which is discussing the financial management service, or FMS, as I'm going to call it over and over again. So one of the beautiful flexibilities of self-determination that Kathy really highlighted is that participants and families are not only held to vendored services or those services or agencies that have a contract with the regional center anymore. Now, like Kathy mentioned, that doesn't mean you can't use vendored services anymore necessarily. And I think it's really important to know that because it's a concern of some participants or families who have vendored services that they really like, they really rely on, and they don't want to lose. As long as the vendored services adhere to those specific community integration rules I mentioned before, you can still utilize them in most cases. But now you also have a choice not to, with one exception, and that is the financial management service, or as we often call it, the FMS. Every participant in self-determination is required to utilize a vendored FMS service. And you can find and interview prospective providers via some links and attachments that we're going to put into the chat to find a provider who best meets your needs. Of note, like independent facilitators and person-centered planners, the regional center can only give you resources for this service, but they're not going to give you recommendations regarding who to use for the service specifically. So it's another reason to do your homework, connect with other participants, and ask your independent facilitator for who to use, because some FMS agencies, for example, won't work with people with medical needs, while others have limits of how high of budgets they'll work with. One area where the participant or family does have flexibility in regards to the FMS is that they can choose to use an FMS agency that is vendored or contracted anywhere in the state, as long as that FMS is willing to work with your regional center. However, if you are working with an FMS that is not currently vendored or listed as working with your regional center, that is something you really want to make the regional center self-determination team aware of as soon as possible, so they can get the process that they need to do started as soon as possible and avoid any delay in service initiation, because honestly, it does take time and work on the back end to make that happen. One thing I really want to stress is that participants and families do not have direct access to any of the money in their self-determination budget, and they cannot make a purchase or pay a provider and expect to be reimbursed for it in self-determination. Self-determination is a waiver through the Federal Center for Medicare and Medicaid Services. And one of the rules and requirements that they have is that all purchases and all funding go through the FMS. A participant or family member cannot be reimbursed at any time and they won't have direct access to the money being utilized to purchase services. That is provided to the FMS through what's known as the purchase of service process and the regional center. The financial management service can be thought of as the bank. They manage the money and the budget. They pay the bills and the invoices. They provide monthly statements, and they help a participant or family member to understand how much money they have spent and how much money they have left to spend. But when I look at them like a bank, I also look at them like one of the big national banks like Wells Fargo, Chase, or Bank of America, that we all kind of love to hate, but we use them anyway. I'm saying that because you may have heard a lot of complaints about the FMS agencies, and honestly, a lot of those complaints are true. There are wait lists, and there are staffing shortages, and there are other fun parts of living in a semi-post-pandemic world. With that said, having a knowledgeable independent facilitator on your team can really help with navigating the associated challenges, as many of them have strong relationships with certain FMS agencies. In addition, being transparent, a lot of the complaints, not all of them, but a lot of them, are related to participants and families not fully understanding the role of the FMS and how limited overall it is, and people expecting more from them than is going to be reasonable, especially considering how little FMS agencies get paid monthly. Just like your bank, which charges you a monthly fee if your account balance dips too low or you make them work too hard for their money by overdrawing your account, for example, FMS services aren't free. There is a monthly fee, but the good news for you is that as of July 1st, 2022, a change in the law no longer requires you to pay for these services out of your budget. Instead, the regional center pays for them separately, which saves you some money that you can use to allocate to other services. This is particularly good because previously, just like the independent facilitator services, the regional center wasn't allowed to add money to your budget to cover this cost, since it was a self-determination specific service, and it wouldn't have been considered cost neutral when compared to the traditional system to do so prior to that law change. With that said, there are still some costs associated with each model of FMS, which we will discuss more in a moment. As I mentioned, FMS services are honestly pretty basic, and that's because the absolute maximum they can charge the regional center per month is $165 per participant. For such a low rate per participant, they can't afford to be super hands-on with every person, much as some would like them to, and that's where some of that part of self-determination comes in. Some people expect FMS agencies to do all the work, to figure out their spending plan, which is the topic of our next training that will talk about how the money is spent. They expect the FMS agencies to make constant changes and adjustments, etc. And to be fair to those people, early on in the soft rollout of this program, many FMS agencies did do that to try to get people in. However, as the volume has increased, it simply isn't possible, fiscally or people-wise, for FMS agencies to provide intensive one-on-one support to individuals and families. And that's another place where having a good independent facilitator is critical. In short, an FMS agency will assist with managing the budget, they will pay workers, they will ensure that all applicable employment laws are followed, which is actually really important because California has some of the most intense employment laws in the country and actually the world. In some cases, they handle the tax forms and they make sure that people are classified properly for purposes of the IRS, which is again, super important and an area I see some confusion and frustration in at times. Some participants try to classify all of the people or agencies assisting them as what is known as 1099 or independent contractors, which means that the participant doesn't have to pay taxes on the money they're paying. And it can save money for the participant in that way. For some places, like established agencies or businesses, that's appropriate. However, in California in particular, being properly classified as an independent contractor means meeting a high bar, and a lot of people will not meet it if they don't have a business license or previous and current experience doing the work that the participant is asking for. Furthermore, there are other requirements, like not being under the control of their employer, being able to set their own schedule, using their own equipment, etc. And you can expect the FMS agencies will evaluate to see if these providers actually qualify. And if they don't, the FMS agency will correctly refuse to classify them as a 1099 and require them to serve as a W-2 employee, where you pay the taxes and insurances on their wages. This is actually for your protection and to save you from significant liability, because the fines for misclassifying employees can be extreme. FMS agencies also help to make sure that workers are eligible to provide the services they are hired to do. So that means verifying required licenses and training requirements. For example, if someone is hired to perform nursing services, the FMS needs to make sure that they are actually a nurse. The FMS may also help providers with getting a criminal background check, which is at no cost to the participant. One thing to know is that every staff member who is performing personal care duties in self-determination needs a new background check completed, even if they previously had one done. Participants and families also have the option of asking other providers to complete background checks as well, even if they won't be performing personal care. In addition, some FMS agencies actually have requirements for background checks that are higher than the law requires. And just like I mentioned that day programs are private agencies that can have their own rules, the FMS agencies are also private agencies that can have their own rules. And as long as they're not discriminating based on a specific disability, given that they are taking on the majority of liability for employment, which is no small task or feat, they're allowed to do that. You can expect that some FMS agencies are going to require all the staff you hire to have a background check completed, and that they're also going to check with the agencies that you're working with to make sure that those staff have a background check too. They may require checks on your employees' driver's licenses, particularly if the staff are going to be driving as well. When you are interviewing FMS agencies, asking about their background check requirements is a good question.
Hey, Naomi, there's a
Yeah.
question in the chat that I don't, can you answer? How did the fees for the FMSs are paid get set?
That was actually in the statute that was passed in 2013. And that's where the rate was set. And interestingly, one of the FMS agencies in California was part of setting that law up. And I'm not really sure how even in 2013 they thought that rate was going to be high enough or tenable, but they did. But it definitely is not in 2022 and in a semi-post-pandemic world. And DBS is aware of the issue, and there are some things in the works to try to fix it, but we're not there yet. Thank you, Julie. One thing that's important to know about those rates for FMS services is that that set monthly rate only pays for the financial management service to provide the service, the payroll, the managing of the budget, etc. That rate does not cover staff wages, employment taxes, workers' compensation, healthcare, other types of insurance if a participant hires their own employees. These costs come out of the individual budget and spending plan, and the budget is not specifically increased to account for these fees because they're already accounted for in the rate the regional center pays to traditional service providers. Now, there are 3 ways in which a participant or family can interact with their FMS. That's the bill payer model, the co-employer, and the sole employer model. And we're going to go into detail about each of those momentarily. Not all FMS providers provide all of these models. So if you are really attached to a specific model, you're going to want to make sure that you pick an FMS that actually offers that model. In addition, it's a really good idea to ask the FMS agency how they pay for services. Do they use credit cards, for example? Because some don't, and that can be more problematic than you might be thinking. Furthermore, I really want to stress that you can have a combination of these services. If you pick the co-employer model, for example, some of your services can still be in the bill payer model as well. But to figure out what model of FMS is best for a participant, they should start by asking themselves a simple question. Will I have employees? The answer to this question will help them to determine which model or combination of models of FMS is best for them. And one of the things we will provide is a summary of the different FMS models for you to review later, again, if you're having terrible insomnia. If the answer to the question, will I have employees, is no, then the bill payer model may work for a participant. In this model, there is no employer or employee relationship. This might be applicable if the participant is only purchasing items like diapers, if Medi-Cal or private insurance won't fund for them, or if they're taking classes from the Parks and Recreation Department, if they're buying a computer from a company, if generic resources have been exhausted, if they're paying for transportation to a company like Uber, if typical parental responsibility does not apply and generic resources aren't available, or if they're hiring a company to supply workers in the home, working with an agency to help apply for a job, or when working with providers who already work with the regional center, like a day program. The bill payer model also might apply if the participant won't have employees because they're hiring an agency or a company to provide people to work with them. In that case, the people who help the participant would be employed by the agency or company. So this could be like purchasing swimming lessons with your budget or choosing to continue to use a respite agency. In the bill payer model, the FMS writes checks and pays for services and supports listed in the individual program plan on the participant's behalf. Now, the bill payer model is typically the least expensive model because it requires the least amount of support from the FMS provider, and it also limits their liability. But it's also the model that gives the participant or family the least amount of control over their services. Switching gears a bit and going back to the question of will I have employees, if a participant answers that question with a yes, and they will have people working for them directly, and the participant wants to have full responsibility and liability as the employer, with support to follow employment laws from the Financial Management Service, then they would pick the sole employer model. A participant may choose this model if they want to be the direct employer of those providing services. The FMS providing services in the sole employer model assists the participant by helping them abide by all the applicable employment laws, verifying provider qualifications and obtaining background checks, paying bills and employees as instructed, and processing payroll. The participant is required to maintain the primary employer liability, and it's the participant who obtains the necessary insurances related to employment, like workers' compensation, which are paid for from the spending plan. These costs would be added to any hourly rate they decide to pay employees, and you can generally presume they're somewhere around 20%. So if you want to pay somebody $20 an hour, you're actually going to have to pay $24 an hour outside of your spending plan. A participant can choose the sole employer model if they desire to have more control over their services and supports, and they want to assume the role of an employer with the support of the FMS. The sole employer model provides the most control to the self-determination participant, but the FMS provider still has more responsibility and liability in the sole employer model, and therefore the overall cost is going to be higher than the bill payer model, but it tends to be less than the co-employer model, which we're going to talk about in a second. With that said, I also just want to recognize that the sole employer model can sound overwhelming. And when I first heard about it, I felt it was overwhelming. But I was proven wrong multiple times in my previous role. And I saw a lot of individuals and families be successful with this model. So I'm really encouraging you not to write it off, to see if it'll work for you and to give it a try. Because FMS agencies that provide sole employer services sometimes have shorter waiting lists than those that provide the last and generally most popular option, co-employer. The cost to use sole employer services is also generally lower, allowing you more funding from the budget to be used for direct services. And some of the sole employer FMS agencies will even help with obtaining insurances and generally just make it surprisingly easy. Now, we've now gone over two extremes, the one where the participant has minimal responsibility and the one where the participant may feel like they have all the responsibility. But there's a third option, co-employer, which I kind of think of as being like Goldilocks. It's just right for many participants and families, and it's the middle of the road. Going back to ask the question, will I have employees? If the answer is yes, but the participant wants to share the responsibility of being an employer with the FMS provider, this would be the co-employer model. A participant may choose this model if they want to share some of the employer roles and responsibilities with an FMS. While the FMS provider in this model is the employer of record, the participant maintains the ability to hire and terminate employees, now with input from the FMS provider to make sure they're not doing anything illegal. For those of you that receive respite under the traditional model, this is similar to how that works, where you can choose your own provider and they're hired by an agency. Now, in the co-employer model, the FMS provider maintains the primary employer liability. They obtain any necessary insurances related to employment, and those are still paid for from the spending plan and are added to the hourly rate for employees. Now, one thing that's important to do is to ask different FMS agencies what their workers' compensation rate is, because some have rates that are higher than others, and this can be a way that you can save money or that you might have to spend more money in co-employer. In addition,
Hey, Naomi.
Yeah.
We have a couple questions.
can I, oh, sorry, Julie, I'm almost done with this
Okay.
slide. Can I just get them right at the
Okay.
end? Sorry, I
Okay.
appreciate you. So one other thing about the co-employer model is if you are hiring a nursing agency for any services, you really need to consult with your FMS as to whether they will even allow that in co-employer due to the liability. In the co-employer model, the FMS also assists by verifying provider qualifications, the background checks, and processing payroll. Now, the co-employer model is the model where the FMS has the most responsibility and liability, and as such, it's going to be the most expensive of the models of FMS. I know I've stressed the waiting list a couple of times already, and that those of you who are better at planning than I am may already be planning to contact FMS agencies as soon as we hang up, and I can't blame you. But I'm going to caution you that most of the FMS agencies won't even talk to you until you have a budget or a spending plan, because so much hinges on specific services as to whether they can assist you. As such, if you haven't already, I would really recommend that you start with the person-centered plan and then move on to the budget. And your independent facilitator should and can let you know when connecting to an FMS agency is appropriate, as well as their recommendations. Thank you, Julie. And now I can take questions. I feel like it's kind of perfect.
Guadalupe, maybe you can unmute yourself. I'm not sure I understand. It says the FMS provide required forms that's certain. Are you asking if they provide the required forms that certain agencies, institutions, and places ask for in order to let employees provide services in their places like college?
So I think I understand it. I'm going to give it a shot. I think
Okay.
the question is whether so for example, if let's say that we have somebody who needs a one-on-one support to attend college. The college may have a specific form that the employee has to fill out in order to absolve the college of liability while somebody is working on their premises who is not their employee. The FMS is not going to have that form. That's going to come from the specific agency. Guadalupe, that was a little bit of a guess, but was that right?
Yes.
Awesome.
She said
That's
yes.
the highlight of my day that I managed
Okay,
to pull
and
that.
the next one is, can you switch your model within the same FMS? Example, if I choose IG and start with sole employer, can I change to co-employer? Is that easier than switching FMS if I choose once that has only one option?
No, it's not easier than switching. The answer to yes, can I switch models is yes. The answer to is it easier than switching FMS agencies in general is no. And the reason why is because most of the FMS agencies that provide sole employer and co-employer provide them under different, what's known as vendor numbers. And vendor numbers are for the regional center to create the authorizations. So if you change models, you're also going to have the regional center redo all of the authorizations. And that is your choice, to be clear. And you are not responsible, nor should you feel like you can't do something because of how the system is built. But with that said, yeah, it's going to be work on the part of the regional center, and it's going to take time. The other thing I can tell you is that a lot of the FMS agencies that provide both models are going to make your employees and your vendors redo all of their forms if you change models. Because again, it's a different vendor number and it's almost like a different entity. Overall, if you can avoid it, I highly recommend not changing FMS models in the middle of the year. Like if there's anything you can do to avoid that, try to avoid it. Because with the exception of 2 scenarios that Julie was involved in, I have never seen that not be a disaster. And it's not because anybody did something wrong. It's because the fiscal system that the regional centers work off of was literally built in the 1970s. And it just needs to kind of be thrown out. But until then, it is not an easy process and it just doesn't work very well. But with that said, if you need to change FMS models, you can. You have the choice, you have the flexibility. I am just forewarning you that it may be difficult.
There's a follow-up question. What about is the personal assistant who assists the client is a relative in the college?
I think what she's asking is, can the personal assistant be a relative? And generally the answer would be yes. There are some limitations to that of who can provide certain services. And it's a very specific question that we can't like completely go into right now, but it's requirements of the waiver. And if the waiver allows the provider of that service to be a relative, and if the relative has the appropriate qualifications, then they can be hired. But just because they're a relative doesn't change the requirements of the FMS, for example. They're still going to have to fill out the same pages. They're still going to have to be formally hired. If they need a background check, they're still going to need to complete it and pass it in order to continue in order to be paid to provide those services. Guadalupe, again, I kind of interpreted a question. Can you tell us if I guessed right? Awesome, I am 2 for 2. I saw one in Spanish. Let me just see something, but I might have just been seeing something. Maybe I hallucinated that. That happens occasionally.
We have just over 5 minutes, just to let the group know, and don't be shy if you have questions. Naomi is a wealth of knowledge, as you can see, so we are so thankful to have her with us.
Kathy, do you want to stop the recording? Because sometimes I find that people don't want to ask certain questions because they don't want to be recorded.
Okay, I'll give it a shot.
Just for privacy, you know, can't hurt. The other thing is,